Namaste everyone. Welcome to the fourth day of Secrets of Yoga Therapy 2.0. And as we are in this journey, today we have another session where we will be connecting the roots of the ancient teachings of Yoga Chikitsa and the modern science of the medical education and the concepts that are needed to be integrated. And we will be having a very detailed understanding of both the ancient and the modern teachings with Dr. R. Balaji. And I welcome him. And before that, let's start with the invocation. Om तत्परंपरयाय विद्महे ज्ञानलिंगेश्वराय धीमहि तन्नो गुरुः प्रचोदयाते ओम ओम योग महर्षि डॉक्टर स्वामी गीतानंद गिरी गुरु महाराज की जय। ओम पुदवई कलमामणि पुदवई शक्ति योगाचारिणी अम्मा जी मीनाक्षी देवी भवनानी गुरु माता की जय। ओम श्री गुरुभ्यो नमः। हरि ओम। So, welcome again, everybody. And uh, I will start with a very brief introduction of Balaji sir. And without much taking time, we want to start. We want to listen to him, and we're very much delighted to welcome Yoga Tilakam, Dr. R. Balaji, sir, a distinguished medical doctor, yoga therapist, researcher, and academician. And to Secrets of Yoga Therapy 2.0, we welcome you, Balaji sir. And Dr. Balaji sir is trained in the emergency medicine and diabetology. He holds a MD in alternative medicine, a PhD in yoga therapy, and an MSc in yoga therapy. And in addition, he has completed postgraduate degrees also in herbal science and Panchkarma, a gold medalist in postgraduate PG diploma in yoga therapy, and MPhil in yoga therapy studies. He has dedicated his career to integrating modern medicine with the traditional wisdom of Yoga Chikitsa. He is a certified master trainer for the Yoga Therapy Assistant course under the Health Sector Skills Council, Government of India, and serves as an examiner for the Yoga Certification Board, recognized by the Ayush Ministry. He has been honored as a Yoga Chikitsa Acharya by the Indian Yoga Association. And Dr. Balaji sir is currently serving as a General Secretary of the Indian Yoga Association, Puducherry chapter, Joint Secretary of Siddha Bhumi, uh, Puducherry Yogasana Sports Association, affiliated with the Yogasana Bharat, and is recognized as a National Yogasana Judge by the Ministry of Youth Affairs. He is also serving as an assistant professor in the School of Yoga Therapy of Institute of Cellulogenesis and Complementary Medicine in Sri Balaji Vidyapeeth, deemed to be university. And he is a devoted student of the Risiculture Ashtanga Yoga Parampara and very dear to Dr. Ananda sir. And for over 3 decades, he has been trained thousands of students under the auspicious of the Pondicherry University and in the Yoganjali Natyalayam, and has served a lot of contributions in the Parampara, in the Gitananda Parampara, and in the Yoganjali Natyalayam. And he also served as an assistant professor at the Center of Yogic Sciences, AVMCH. And he presently, as I mentioned, he is working here in the School of Yoga Therapy. And Dr. Balaji sir has authored and published scientific papers and abstracts in both yoga and medicine in reputed journals, and has presented his work widely. His remarkable contribution have been recognized with numerous awards. Lots of awards uh, he has got, like Yoga Chemmal, Yoga Tilakam. He has been got the Best Yoga Master, Champions of the Champions, Best Teacher Award, Dynamic Yoga Award, Best Yoga Asana Demonstration Award, Best Karma Yogi Award, Michael Dankworth's Gold Medal in Yoga, Best Young Faculty Award, Best Doctor Award. So, with all these awards and a lot more, I have mentioned only a few. So, today Dr. Balaji sir will be sharing his insight with us on modern research meets traditional wisdom, evidence-based yoga chikitsa. And I welcome the audience to feel free to share your questions via chat, and we will address them at the end. So, with this very brief introduction, I would like to welcome Dr. Balaji sir. The stage is yours. Namaste.
Thank you, Nilachal, for your kind introduction. I hope my voice is clear. Without much ado, I would like to share my presentation and go with my presentation. Is my screen visible?
Yes,
Nilachal, is my
Balaji sir.
screen?
Yeah, yes,
Okay.
it is visible.
Okay. Namaste again. Good evening, Vanakkam, from this part of world. And yeah, it's my favorite topic because I'm representing both the modern medicine and yoga therapy, yoga research, and what all I feel as an integrative medicine and what I am practicing as an integrative medicine and what is the outcome of integrative medicine. I just want to share all these things in a nutshell today. And yeah, we have a lot of discussion and anything, any doubt, you can just put in the chat box and we'll discuss in after finishing the presentation. And to move on, slides sharing. So I just want to show the respect to my gurus and teachers. They are the one who said the knowledge and that had flowed. And what I'm here, it's because of them. And to know again and to I will say wherever I go, Dr. Ananda sir is my only guru, who's the guru of both yoga and medicine. Though I have a lot of professors, teachers, clinical professors exposures in the modern medical field, and Dr. Sir is a one person who has both roles for me as a guru in both yoga and medicine. So offering my pranams and namaskaram to Dr. Ananda Sir and all the gurus of Gitananda tradition, I will go to the presentation today. So I just want to cover, I'll just go what is integrative medicine and what are the prevalence of the diseases and what is a drug, because as a modern medicine practice, what does a drug does, its mechanism of action, and how yoga and medicine integrate, how we are integrating in the setup. And as a result of that, we have did a lot of research, and I want to conclude with what is the integration is about and what is the result of integration. So to go further, what is integrative medicine? So the definition goes like that. It is an holistic approach combining modern medicine with complementary system. So this is complementary. Don't take it as a mistake. It is combining the modern medicine with complementary systems like yoga and Ayurveda. And what is the focus here? We are not focusing the symptomatic management. Like Ananda sir used to say, it is not a yogapathy. We are not doing a symptom-based treatment. The main focus is on the patient-centered care, evidence-based practices that we look into some kind of investigations, because that is very mandatory to see in which state of pathology is your body and mind is there. So if we know your pathological state by the proof, by the investigations, then we help to move to a salutogenic way. So the investigations are very, very valuable for us. That is what it's evidence-based practices. And again, by combining the allopathy and the modern medicine and yoga therapy, we try to heal the Annamaya Kosha, Pranamaya Kosha, Manomaya Kosha, and elevate you in a state of health and well-being, the holistic approach. And this is what the integrative medicine, and this is what we are trying to do in all our activities. The next one is, what are the components of integrative medicine? So, yeah, conventional medicine, modern medical medicine, it is evidence-based because a single investigations, for example, a simple urine test, it can detect that you are dehydrated or not. It can detect you have urinary tract infection, that the simple urinary test examination can tell you whether you are hypertensive with the leakage of the albumin, the proteins there, and the kidney lobe, whether you are going to have the kidney damage or not, whether the protein leakage is there or not. A simple urine test can be detected by doing a simple urine test, which is 50 rupees of cost. And definitely drugs involved in conventional medicine. And I will explain what is the importance of drugs. And remember, there is surgery. That is the last option of treatment. We tried everything, and for some, surgery is the treatment of choice. For example, if I say a simple hernia, definitely if you go and try, it is protrusion of the contents due to the incapacity of the abdominal walls. So you can strengthen, but you can't be able to replace the contents back. So for example, the things like appendicitis. Appendicitis is a vestigial organ. Once it is gets inflamed, we have to cut and throw it out. So definitely surgery is a treatment of choice for some kind of issues. And definitely surgery is the last option. And after surgery, we need to rehabilitate the patient. That whereas the integrative medicine, the yoga therapy plays a lot of role. The mind-body practices, which enhances the emotional health, and stress regulation is done by the other alternative techniques, the complementary techniques, especially the yoga. And we also do the patient-centered healing relationship because none of the therapy is complete without dealing the dietary habits. What are you eating? Where are you eating? How are you eating? All these things are matter. And hydration is a very, very important part, and sleep, bowel, and bladder habits. All these things has to be addressed in an individual if he is suffering from some kind of a disease or disorder. Not just giving few asanas, not just giving a few pills. That is that help to manage the acute things. That is a symptom-based management. But to see a person, all these things are very, very important, and these are the real components of integrative medicine. And now go into the prevalence of diseases. Don't get shocked with this percentage, but it is the truth. And the very common diseases, disorders I have mentioned here. So you can see that diabetes, 14% of adults worldwide have diabetes in 2022, which has doubled the rate in 1990s. The global prevalence is expected from 6.1 to 9.8 percentage. It's a very, very high alarming state. And next is the hypertension. 1 billion people, remember 1 billion people worldwide have hypertension. And the most sad part is only 21 percentage of the affected individuals have the disease in the country. This is very, very alarming. So hypertension is also one of the disease. It has a similar complications like diabetes, which can damage your kidneys, your brain, the nervous system, and the retina, the eyes. So only 21%, that is a very, very sad state. And obesity is a very, very, just for the past few decades, the obesity is increased tremendously. And you can see by 2050, 50% of the adults worldwide will be overweight or obese. And it is usually seen in low income and middle income countries. India is also, it's in the third or fourth rank in the range of obesity. Dyslipidemia. So dyslipidemia is not only the increase in the total cholesterols or the triglycerides, it is also the decrease in the high density lipids. High density lipids are called as the good cholesterol, the karma yogic cholesterol. If a high density lipid is high, you need not to worry when your cholesterol or triglycerides is high because it will take care of it. You have to just monitor yourself. But the status is not good in this part of world, and especially mostly in India also. So you can see hyperlipidemia affect 39% of adults globally, and definitely it leads to the cardiovascular disease. If it goes to the brain, it becomes stroke. It goes to the heart, it becomes a heart attack, the myocardial infarction. And next one is psychiatric disorder. So before COVID, it was 1 in 8 people, they have a psychiatric disorders. And we all went through the phase of COVID. COVID is still is there within us. We are living with COVID, and COVID also is living with us. I'm still seeing a patient who are having the COVID complications. And oh my God, it is very dark phase, and still it is there. And the number of psychiatrically affected, mentally affected patient is doubled after COVID actually. And the next one is reproductive illness. This is India is number one populated country in the world now, but the percentage of uh, polycystic ovarian syndrome and infertility is keep on increasing every year. Nine representing 698 million people worldwide is affected by infertility. This is really alarming stage. And the next one is suicides. 800,000 people die by suicide. That means one person in every 40 seconds. Very, very sad state. And today uh, morning, I saw my WhatsApp in my medical group. I saw a news that Pondicherry ranks third in suicide in India. I don't know whether I feel happy or bad because last year, before that, Pondicherry was the first in suicide attempts in India. So whether we move to third, I may feel happy, or whether still in the top three, I feel bad. I really feel bad because Pondicherry is a very small state which has 8 medical colleges, one state and one central government medical colleges. Pondicherry has become an educational hub, and we have a lot of things in the spirituality also, spiritual side also. Even though we don't give that much importance to the feeling of the youngsters, and feel very, very bad that remember every 40 seconds, if one person is suiciding means then what kind of world we are living in? That much stress, that much peer pressure is happening in those peoples. Definitely, we have to do something. And the next one is road traffic accidents. It's very, very, I have, as a emergency physician, I have seen lots of accidents. Even I can't imagine how the cause, 1 millisecond or 1 second misjudgment had ended many people's life. It is not about how we are driving. It's about the people who are driving with us. That is also one of the reasons for the road traffic accident. Similarly, my family member faced because of it's not her fault. It's by the people who ride with her, and we had some kind of a real problem with that. So worldwide indicating 1.19 million annual road deaths. It's really, really very pathetic state. And cancer, I don't want to focus more on cancer because 35 million new cases by 2050. It's really, really, again, alarming. So if these are the things, the next one is furthermore, because I also work as a medical consultant in an alcoholic and cannabis re-addiction and rehabilitation clinic. So global mortality rate due to addiction, which is only because of alcohol, it is 2.6 million deaths annually. And combined of illicit drug use and alcohol, it is more than 3.2 million deaths because of addicted substance, nothing else. And in India, it is further worse. You can see the substance abuse in India. This is a 2022 survey. Alcohol users is 16 crore. And people who are having problem by using alcohol is 5.70 crore. And dependent user is 2.9 crore. I don't know what to tell and why it is. Every year, the number is keep on increasing. And similarly with the cannabis users and opioid users. These are non-modifiable risk factors. These can be stopped. But I don't know. These things are not happening. And every year, it's just keep on increasing. Now, what is the role of a drug when it enters into your body? Because I have seen patients when in yoga therapy, I ask them to do, I am a modern medical doctor, I will advise you to do some kind of yoga techniques that will help you in your disorders or disease. They say, doctor, I'm very busy. If you give me a tablet, prescribe me a tablet, that will that will take care of my issues. So what does the drug actually does? See, there are two things will happen. That is the pharmacokinetic and pharmacodynamic. Pharmacokinetic is what is the journey of drug in your body. That is pharmacokinetic. The drug goes, absorbed, it is distributed, wherever the pain and it is metabolized and it is get excreted. The journey of drug in your body goes inside and comes out. That is its pharmacokinetic. Pharmacodynamic is what does the impact that drug creates to you actually. And wherever the problem, it just goes and bind to the particular receptor. It works for a certain time. It gives some therapeutic good feeling. And then before going, it causes some side effects. Definitely, every drug has a potential side effect without or with your knowledge that is happening inside you. For example, there is a new oral hypoglycemic drugs, a drug called dapagliflozin, which is a SGL2 inhibitors. It is a very, very good drug for diabetic, anti-diabetic drug. We call it as a DAPA. Even it's a magic drug. Nowadays, people used to call it as a magic drug. And it is comes in a very good, very, very low dose only, 5 mg or 10 mg. 10 mg is the maximum dose of DAPA. This is a very, very good drug. Recently, I gave to 20 of my patients in the last 45 days or so. In that, two patients have developed the side effects. The side effect is how this drug reduced blood sugars is by increases excretion of glucose in the urine. That's very simple mechanism I'm saying. People who are not have that much immunity, they will develop an ulcer and they will develop a UTI, urinary tract infection, and ulcer in the gland penis. See, if you want to treat for to make a good control of sugars, but this drug is can't tolerated by few patients, and they develop ulcers and urinary tract infection. 24/7, they have some burning sensation in the excretory, the reproductive organ, the male penis, and what to treat now? To treat, I want sugar control, so can I ask them to continue the drug? Definitely, it is not ethical. So I have to change the drug. This drug is a magic, but it has a very, very potential side effect. Just for example, I told each and every drug has a potential side effect. That's what I mean here. So drugs are good for acute purpose, but if you take for long time, definitely it has its own side effects. And if you're not taking the drug also, that is also a problem. If the medicine is not taken or skipped, as I told, as a doctor now, I told drugs are giving side effects. So Dr. Balaji told, don't take drugs. No, 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 no. I didn't say like that. Okay. So what we are not dealing with one drug, you have to see your doctor and you have to, there are multiple options are there with the drug. I doesn't say stop the drug. But if you stop the drug, what will happen? The symptoms will get flatter and all the acute problems you have faced, that will increase and you will get into an emergency ward in the EMS, emergency medical services. And if you keep on doing it, then it will cause organ damage, permanent disability, and there is a chance of getting moksha without taking a drug. This is I just want to keep it in a way because nowadays people are with very, very, they want to know allopathy is fraud, allopathy is money making, drugs are not good, drugs will damage our body. So we are switching our treatment to Siddha, Ayurveda. No, I'm not blaming that other systems are bad. For acute conditions, for emergency condition, allopathy is the treatment of choice. We have seen many patients who doesn't have any control of the blood sugars, they will end up having nephropathy, neuropathy. Nephropathy is one of the commonest complication. The chronic kidney disease is one of the commonest complication if your sugars are not under control. Those people have tried the Unani medicine, Siddha, etc. So allopathy is very, very good for control and prevent the acute damage. But to the long run, it is definitely not good. That is what I'm going to see in the next slide. If you are taking drugs for a long time, you don't change your attitude, you don't change your lifestyle, you don't change your perception, and you keep on doing whatever you do, but you want the drug to take care of everything. Is it possible? Definitely not. Definitely not. It should come from you. Then the drug will help you to take care of it. And prolonged drug intake, what will happen? All these things will happen. See, if you're not taking drug, also organ damage is happening. If you're drug dependent for long time, how the liver will metabolize all, because each drug is a chemical. And definitely prolonged intake of that without changing your lifestyle, without changing your attitude, definitely that will also lead to organ damage, reduced quality of life, dependence, and lot of things will happen. Prolonged intake of that without you, if you think that the drug will take care of everything, it will take care. If you skip your drug, the life will end in a very short time. Prolonged intake of that, another 5 or 10 years, definitely that will also, you will get moksha. So this is the one thing which I want to emphasize in a very short time. What is drug and what does it drug to our body? Now come to yoga, because basically we are the care seekers, helpline, health professional educators, yoga therapists. So how yoga works? We all know yoga works by the parasympathetic activation. Each and every techniques in yoga have their own mechanism of action. Asanas, they gently stretch, and the holding stimulates the mechanoreceptors, wherever may be there. Asana is very good for this musculoskeletal system. Pranayama is one of the beautiful practices in the body which connects the body and the mind. And pranayama can be given as a monotherapy, and pranayama can be combined with asana and kriya and give as a polytherapy also. One of the beautiful things, I love pranayama and surya namaskar. Those two are my favorites in yoga therapy. I like everything, but those two are very my favorites in yoga therapy. And the relaxation techniques, see, they directly reduces the cortisol is the stress hormone. They directly reduce, act on it, and they decreases that the active response you give, the active reaction you give, directly act. Okay. So the conservation of energies is happening in the relaxation technique. Dr. Ananda sir, often he says, if you don't relax, how you will heal? Relaxation is the key element of healing. And yoga always promotes relaxation. Yoga always promotes healing. So all these things we all know, it is decreases the heart rate, increases the HIV. I'm not going into those details. If you're taking drug for a long time, you have some problem. But if you do yoga practice regularly, what will happen? See, I have told during practices, asana, pranayama, relaxation technique, during practices, we have seen some changes. But after practice, that is sustained in your body, the muscles become relaxed and the tension is reduced. You have an improved metabolism. Okay. And the heart rate and blood pressure is stable. We have done a number of studies in blood pressure that yoga therapy has, if maintains the blood pressure in a very, very controlled way and enhance the lung capacity and increases the vagal tone. I will let you know about what will take. And the most important thing is here, that regular yoga practices helps that resilience to stress is adapted because of yogic practices and mental clarity. And the most important is improved gut function. How the gut function is improved? Yeah, definitely. I will tell the mechanism of action. And the parasympathetic dominance is sustained, followed by each and every practices. See, if you take a drug, there are drugs we have to take 4 times a day. For example, Dolo 650, a very common in nowadays because this is a flu season. Okay, you have to take 6 hourly. That means 4 times a day. Most of the antibiotics 2 times a day. And the drugs which helps to the enzymes for healing, you have to take 3 times a day. But yoga is like that. You have to take it for every day. If you miss the antibiotic course, normally the antibiotic course is 5 days. If you take the antibiotic for 3 days, In 3 days, your problem is solved. The next days, if you leave, next day and next time when you face the same problem, you can't take the same antibiotic. You would develop antibiotic resistance. Then we'll go for higher antibiotics. Each antibiotic has a potential damage to kidneys as a choice. Chance is there, each antibiotic. But yoga therapy, you need not to do all the days. And you need not to do once, twice, thrice daily, four, not you have to do not the 3 times or 4 times a daily. One time. It's almost beneficial. 2 times, excellent. And it doesn't have any side effects at all. It has a lot of positive effects. That is what I want to emphasize here by comparing the drugs, the allopathy, and the yogic practices. They are good. Drugs are good for acute periods. And if you keep on only taking the drug, you will definitely end up in trouble. When you combine the yoga practices, a lot of miracles will happen. That is what is my aim to explain in these slides, actually. Next is the mechanism of action, what I told how the yogic works. We all know yoga reduces, it is a parasympathetic dominance, it decreases the blood pressure, it enhances the mental clarity, it stretch, it lung capacity. How it happens? See, in our body, we have cranial nerves. 12 pairs of cranial nerves are there. And these cranial nerves run from the brain and it connects to the spine and all important parts of the body, especially the head and neck, chest and abdomen. Head and neck, chest and abdomen. Khatam ho gaya. All vital organs are here only. These cranial nerves take care of everything. What are the minimal action we do? The reflexes, the heart rate, the digestion, everything is taken care of by these cranial nerves. They are 12 in pairs. In that, the 10th cranial nerve is vagus nerve. Vagus nerve is both motor in nature, secretory in nature, and it has the largest cranial nerve. When compared to the 12th, vagus nerve is the largest cranial nerve, and it has a lot of parasympathetic fibers also. How beautiful! It has a lot of parasympathetic fibers. It is both secretory and motor in nature, and it is the largest cranial nerve. And what are the yoga techniques we are practicing, like asana, pranayama, relaxation techniques? Everything influences this vagal nerve, and the vagal tone is attenuated in each and every yogic practices. And by enhancing the vagal tone, we get all the benefits. All the benefits are measured by the apparatus we use by doing the investigations. And this reduces lot of complications and which is very good for to maintaining a proper health and well-being. This is a simple mechanism I want everyone to understand here. Yoga is parasympathetic in nature. How it is parasympathetic in nature? And don't tell yoga reduces the heart rate, yoga reduces the blood pressure. Yoga and its techniques works on the most important parts are like the cranial nerves in the body, which is connected to the head and neck, chest, abdomen. Abdomen means some people say stomach is the abdomen. Some people say just kidney, liver, pancreas is abdomen. No, abdomen is from everything. It starts from the mouth, it starts from right hand and it ends in left hand. Okay, the entire gastrointestinal tract, we call it, that's everything is abdomen here. Okay, and it includes the reproductive organs also. These cranial nerves play a vital role in managing the most important functions of your body, and yoga techniques helps to attenuate these cranial nerves, especially the vagus nerve, the 10th cranial nerve. So this is my short mechanism of action, how yoga techniques helps in betterment functioning of our health and well-being. So next we go into this. What is the advantage of taking this yoga and medicine? Now it's coming. This is my favorite. Wherever I go, I used to speak both about yoga and medicine in my clinic. Definitely for the patients, I will speak about yoga techniques in our yoga OPD and the ISCM School of Yoga Therapy. For some people, I definitely prescribe some medication. So wherever I go, I used to speak both about because these are my favorites. And when you combine both yoga and modern medicine, what happens? Reduce side effects. There is There is no side effects at all to me. It will give some positive effects to me. And the most important thing is holistic healing and improved patient adherence. That is the most important thing. When a patient feels that his treatment is worth, when patient feels that his overall health is good, then what is the best gift as a therapist you want from them actually? And this is the most important benefit of combining both yoga and medicine, according to me. So I just want you to show a few research evidence how we applied yoga as a therapy in certain disorders, and we have managed with giving yoga as an adjuvant therapy, and we compared with the standard medical management. And one thing is, first, this is one of my favorite research until now. To the best of my knowledge, there is only one paper in diabetic lung. Is the paper we published from the School of Yoga Therapy at ISCM. Thanks to my senior Dr. Madan Rachar, who's a senior pulmonologist in Pondicherry, who gave me the idea of diabetic lung. And again, thanks to Dr. Anand Balayogi, sir, because during my MPhil study, when I told him about this diabetic lung, he gave me a full support, full freedom, and the confidence this research was done. So, what is diabetic lung? When people who are having blood sugars, they are chronic blood diabetic patients, when the sugars are not controlled, we do the spirometric analysis, and less than 70% of lung function. The people will have a chronic diabetes who have their uncontrolled sugars, the lung function will be less than 70%. Those people are termed as diabetic lung. So we recruited nearly 70 odd patients, and by the spirometry, and we randomized into group A and group B. What group A did was they took standard medical management in the form of bronchodilators, the inhalers, the oral hypoglycemic drugs, and also adjuvant yoga therapy. Weekly 3 times they will come to School of Yoga Therapy, and in the supervisor sessions they have. And group me only the standard medical management. That means they have the bronchodilators, oral hypoglycemic drugs. That's it. And we did the study for 4 months. And each week, 3 classes. And 4 months, around some 48 to 50 odd classes. And after 4 months, we again did the spirometry. Because they are diabetic patients, we studied other parameters also. What yoga therapy schedule we gave them? So the most important yoga therapy schedule, the maximum, the bulk of the schedule is Hatinas and Astikams. People who are associated with Gitananda Yoga tradition, they know well about the Hatinas. Hatinas is the only technique which has a combination of asana, pranayama, kriya, and relaxation technique, which is designated entirely to the respiratory system. And true, by improving the respiratory system, all other systems also indirectly benefited. That is the beauty of Hatinas, is one of my favorite actually. And we have given this Hatinas 30 minutes for each class. And we also gave other practices like Chandranadi, Brahmari, and Shavasana. So what was the result? When we found out, after 4 months of study, what we found out was the spirometry values. The spirometer has 3 values: the force, expiratory volume in per second, force vital capacity, and the ratio between them. So people who had yoga as an adjuvant therapy along with the standard medical management, the vital force expiratory volume in per second has increased, and it is statistically significant. People who know statistics, 0.003 is very much. And see, in control, it is nothing has happened. And in force vital capacity, it is a very, very valid indicator how much the power, the strength of your lungs. That is measured by the force vital capacity, and it has increased from 2.43 to 2.9. And then again, it is statistically significant. And the ratio between them, if you see people who had done both modern medical management and took yoga as an adjuvant therapy, it is increased. But in people, the symptoms got deteriorating. It is the respiratory function was deteriorated, and that is also statistically significant. That's what I told in my previous leg. If you take only the drugs, you don't do any lifestyle modification, if you don't do any other activities, you don't change your attitudes, definitely it won't get controlled. And again, it is proven in this research study, taking yoga as an adjuvant therapy along with modern medical management definitely improves the condition, definitely improve your health. And only by taking modern medical management, the symptom is getting worse. And next, one more, the same in the same study, we found out that I already told that diabetes, the most common complication of diabetes is the chronic kidney disease, CKD, renal failure. And in the most, India is the place where a lot of chronic kidney patients are there and they are going for a lot of dialysis. And these two parameters, urea and creatine, these two are parameters which decides whether we have to go for dialysis or not. Especially the creatine is very, very notorious. The normal range of creatine is 0.5 to 1.5, but if it is goes more than 1.2, 1.3, mostly half of the nephrons will be died. Nephrons is the fundamental unit of kidney. 50% of the nephrons is already died. So we studied the urea and creatine in those patients also. You can see the difference, how the urea is reduced from 33 to 30 and creatine, how beautifully 1 to 0 point. This 1.02 to 0 point is a very, very big change because see, kidneys can be damaged in two ways. One is in dehydration. One, the kidneys can't able to filtrate many things because of the dysfunction happen because of the diabetes or the hypertension. And these two things are very, very dangerous. In the dehydration is very, very easy to treat. If you are not treating the dehydration properly, definitely it will also cause death. But in these two conditions, only these two things were become abnormal. Mostly, I'm talking about 60 to 70% of the common problems. So just that yoga therapy schedule, along with the standard medical management, along by adding yoga as an adjuvant therapy, improves your renal function also. So this is what is about integrative medicine. This is what we are doing in our research studies at School of Yoga Therapy and ISCM. Next one is metabolic syndrome. This is my PhD topic. I did this under the guidance of Professor Meena Ramanathan ma'am. Again, thank you, Meena ma'am and Dr. Ananda sir for giving me full support and freedom and the trust. And really happy with the things it went. Metabolic syndrome, it's a very new term when I was before COVID, but it was very, very common name in the medical field. And prevalence is very, very high because it's a combination of diabetes, hypertension, and obesity, and increased cholesterol, decreased level of HDL. This is out of these five, if people have any three, they are termed as metabolic syndrome. So this is a very, very common in this part of world. Everywhere now, metabolic syndrome is very common now. Diabetes and hypertension like twin brothers, twin sisters. If one comes, if you're not taking a good care of it, another 2 to 3 years, either of, if you are diabetes, hypertension will come. If you are hypertension, diabetes will come. So they are like twin brothers. And how this is starting, diabetes and hypertension is come because you are overweight, obese. That is a common reason. And if you're overweight and obese, automatically your cholesterol levels also automatically deranged. Everything is interconnected here. And we did some good statistical analysis with this metabolic syndrome. What I want to say is these people underwent, they take modern medical management in the form of antihypertensive or anti-diabetic drugs, and the obesity, we didn't give any drugs. For the people who had the cholesterol levels are high, we gave them some anti-cholesterol drugs. That's it. And additionally, we gave adjuvant yoga therapy, which was a very big protocol. And this study was done for 6 months. We did the baseline parameters before starting the research. And at the third month, we did the intermediate study. And the post, after 6 months, we did the study. And we found out the clinical significance. Clinical significance, as I mentioned the formula above, I want as both a doctor and allopath yoga therapist, I want to know what is happened by only giving modern medical management alone and adding yoga therapy, what the clinical significance is happening just by adding a yoga therapy. If you see in the systolic blood pressure, Only in the modern medical management, 51% improvement is there. And if you add yoga as an adjuvant therapy, nearly you can reach more 96%. Systolic blood pressure is the one where the heart has the maximum pressure. It is happening in the systolic phase. The normal range is 120 millimeters of mercury. And during that maximum contraction, heart contracts, it sends the blood to the pulmonary vein and the aorta, it sends blood, the pure blood to all parts of the body. The systolic blood pressure is the maximum contraction, 120. When people are diagnosed with hypertension, a doctor, we see it goes to 140 also, we don't become panic because it is a maximum contraction is happening at the time. But the second guy, DPP, diastolic blood pressure, is a very, very important um, in this blood pressure. This is very, very important because in diastolic blood pressure, the heart supplies its own blood supply. That is diastolic blood pressure, and it is a minimum contraction is happening at that pace. And this is 80 millimeters of mercury. If it goes to 90 millimeters of mercury, immediately the allopathy doctors, will press the panic button because it goes 100 means there is some kind of leakage, chance of leakage will happen within the heart. So that diastolic blood pressure is very, very important. And definitely pranayamas has a very, very important role in controlling the diastolic blood pressure, especially the nada pranayamas, the sound producing pranayamas. Because the inhalation is less when compared to the exhalation. Exhalation is more compared to inhalation in nada pranayamas. If you exhale more, the diastolic filling is more. Diastolic filling is more means it will prevent the heart failure. Now, see, with modern medical management, there is only 91%. Of course, diastolic blood pressure is more important. Just adding yoga as an adjuvant therapy, you can improve 97%. And this 6% is improved is very, very significant in the terms of outcomes. So that is what adding yoga as an adjuvant therapy gives a holistic health and well-being. Similarly, in triglycerides and HDL, see, we all know about that. There are anti-lipidemic drugs are there, anti-lipid drugs. The amount of work these anti-lipid drugs is doing is very, very little. To be frank, I'm a doctor. I'm saying this. Yeah, I have my friends agreed it who are a doctor, and my wife, who is a pharmacologist, she also told the same statement because these anti-lipid drugs, only 10 to 20 percentage of improvement will be given by it. And they improve more to increase the HDL, not by reducing the triglycerides. Total cholesterol is nothing but it is total summation of high density lipid, low density lipid, and very low density lipid. But triglycerides, we don't have. See, only with the modern medical management, 9.1% is there. And by adding yoga as an adjuvant therapy, see the improvement. I need not to tell you anything. How beautiful adding yoga as an adjuvant therapy to the modern medical management, how much improvement is there? And the next one is the HDL. I already told about HDL. HDL is a good cholesterol, and already it's 71% with the modern medical management. And whenever we feel very happy when we find the full potential within ourselves. So by adding yoga as an adjuvant therapy, our heart gets a full good benefits of reaching the maximum levels. This is the beauty of adding yoga as an adjuvant therapy to the standard medical management. And the next one is, we also want to find how many times the clinical outcome improvement is there by adding yoga as an adjuvant therapy. For that, we use odds ratio. It is the association of exposure with the outcome. So that is odds ratio. So we planned that adding yoga as an adjuvant therapy, 11 times improvement is more. It is not 1 time, 2 time, 3 time, 4 time. It is 11 times. Just adding yoga as an adjuvant therapy. See, again, they came for yoga therapy weekly twice. They came weekly twice for 6 months. Yeah, there are some dropouts are there. As a research study, we will definitely face some dropouts. The people who came regularly, especially for the first 3 months, they saw the benefits which I showed them with the blood investigations. and they saw the physical changes with them. And they did intensive training in the next 6 months, and the beautiful result had come. And just by adding yoga as an adjuvant therapy to the standard medical management, 11 times improvement is achieved. This is the beauty of integrative medicine. And the next one is one of my favorite slide. And thanks to Dr. Ananda sir, because he only gave the idea. And I told metabolic syndrome is cluster of diseases, diabetes, hypertension, dyslipidemia, obesity, and decreased HDL. And if you see in the group, 36% had obese, hypertension, and decreased level of HDL. And after 6 months of yoga as an adjuvant therapy, see the post-intervention in the center, only one person is there. Dealing with a single culprit is always easy with dealing with the multiple culprits. And definitely yoga helps to decluster the diseases and brings back the original health. And this is salitogenesis. Yoga therapy is definitely a salitogenesis. This is a Pakka research evidence that adding yoga as an adjuvant therapy, the traditional wisdom mixed with the modern medical management, wonderful result is happening. So this is what, if you, as a yoga practitioner, I will advise yoga therapy is the good lifestyle modification I used to see. The next one is furthermore uh, interesting is that spider web diagram. If you see the spider web, we have ranged from 0% to 100%. The red color indicating the pre-status of the metabolic syndrome before starting a yoga therapy. And you can see the dyslipidemia and diabetes is 100%. And obesity, hypertension, obesity is nearly 80%, 90%. Hypertension is 80, and people who have decreased level of high density lipid is also 80%. And after 6 months of adjuvant yoga therapy, see how the spider web has shrunken in obesity, hypertension, and high density lipid is increased. Nearly 80% of the people had a decreased level of HDL. And after 6 months of yoga therapy, almost all the people had an increased high density lipid. But even though diabetes and dyslipidemia, they came under normal, but they can't able to reach the betterment outcomes. That indicates furthermore yoga practice is needed to get the further clinical improvement. So this is one of the beautiful example what happens when the modern scientific approach meets the traditional wisdom, and the outcome is wonderful. And really happy that this outcome had happened. One concept I want to say here, many of you are very know about this, how the concept of origin of disease. According to this, the disease is psychosomatic in manifestation. Psychosomatic. It starts from the manomaya kosha and disturbs the flow of the prana and manifests as a vyadi, a physical disease in the annamaya kosha. This is how the disease is origin. But how yoga helps in a reverse way, somatopsychic in nature. And by that, working through the Surya Namaskar asanas in the Annamaya Kosha, along with the Pranamaya Kosha, with the Pranayama and the relaxation techniques, it corrects the soma first, and then through the breath, it improves the psyche from Annamaya Kosha to Manomaya Kosha through Pranamaya Kosha. And I told that it increases the digestive, balances the digestive fire without overeating the system. That is the beautiful of this pranayama. Whatever we do, some kind of a jogging, we do some kind of aggressive exercise, the body will automatically overheat it, and definitely the metabolism will increase. But our pranayamas, like the cooling pranayamas, it balances the digestive fire without overeating the system. That is the underlying physiological mechanism that doesn't disturb the homeostasis. That internal environment is not disturbed. That is the beautiful of this yoga techniques, especially the pranayama. And definitely, yoga technique has a potential ability to decluster the metabolic syndrome and goes to the salutogenic method along with standard medical management. And the next one is, the next thing we have spoken about is the alcohols. So thanks to Mother Care Foundation, I have been associated with Mother Care Foundation as a medical consultant for the past decade. Uh, my friend has recommended this without my knowledge. 10 years back, when I got a call from this chairman of Mother Care Foundation, I was very hesitant to join as a medical consultant there because during my training in emergency services, when I see the alcoholic people, I used to shout at them, and I don't give injections to them when they come for alcoholic gastritis, having severe pain in the epigastric region of the abdomen. I will tell them, because you take alcohol, you suffer this pain, and next time you don't take alcohol. This is totally unethical because I don't like alcoholics. But when I was discussing about this to my wife, Dr. Shamli, she told me, dear, all people who take alcoholics are not bad, and people who are not taking alcohol are not good. These two, these lines has sounded very much within myself, and thank God I made the right decision of joining there as a medical consultant. And you can see the beauty of all the people who are admitted in the alcoholic and cannabis de-addiction rehabilitation, doing a pranayama, Surya Namaskar sessions, and they have do lot of counselings. And we have started yoga as a part of a treatment in the Mother Care Foundation, MCF. That is a part of treatment for alcoholic de-addiction and rehabilitation techniques. And we didn't stop from there. We did a research in there also. Before that, I want to meet what is the concept of this addiction, where it comes from. It is there in the prefrontal cortex, a culprit called nucleus accumbens. You can see the nucleus accumbens, which is there in the prefrontal cortex, which also has a VTA, ventral tegmental area. What is this nucleus accumbens? It is a pleasure center which responds to dopamine. It is a part of a lizard brain, respond to drugs, food, and sex. So that is a stimulus actually. This pleasure center is abnormal. It is damaged in addicted patients. So what is this nucleus accumbens? It is a simulation of the reward pathway, produces highly pleasurable sensation, providing positive reinforcement which promotes further drug use. It is there in the limbic system consisting of the nucleus accumbens, ventral tegmental area, prefrontal cortex. Okay. And what is this? Because we have the reward system of two types, natural and artificial rewards. Natural rewards are nothing but we all are experienced this natural reward. Whenever we get a smell of some kind of a biryani or some favorite food, mind goes there. Water, sex, definitely these are the natural stimulus, and we know what the reward we'll get by going into the natural stimulus. The artificial stimulus is the drugs. Information travels from the ventral tegmental area to the nucleus accumbens and then up to the prefrontal cortex. This ventral tegmental area contains dopamine, which is released in nucleus accumbens and in the prefrontal cortex. That is why you can able to feel that pleasurable sensation. This is the reason. And if you are not controlling ourselves, we are keep on doing it, then the neuronal circuit is totally disintegrated. See the neuronal circuits of non-addicted brain, the addicted brain. There is every way there is input and output is evenly distributed in the non-addicted brain. See in the addicted brain, where is the control and memory? See people who take too much of alcohol, they behave very badly, they speak ill words, they even go and beat someone. And when you take, when they wake up in the next morning, they will have did I behave like that? I don't remember anything. And nowadays it is called as with a very what prestigious name called hangover effects. I really irritated whenever I hear that hangover. Because of that hangover effect, because of this over dominance by these addicted, there is no control over your memory because the total cognitive function is totally lost. And how yoga helps. And we also did a study there, effect of yoga as an adjuvant therapy. Here also, there is a modern medical management along with it every day or once in a three days in a week, we gave them as a yoga as an adjunct therapy. During this project only, we implemented yoga therapy in the MCF. After that, now every day, the patients who are admitted there are doing yoga as a yoga therapy, yoga practices is happening daily. So alcohol craving questionnaire. So alcohol craving. So that has people who are taking yoga along with the standard medical management, and control is only the standard medical management. And see the craving, how much it is reduced from 6.9 to 4.59. That is the power of yoga along with the standard medical management. Then the perceived stress came. Perceived stress. Everyone have their own way of perception. Each individual perception is different. And see, before pre-27, it is severe perceived stress is there. And after yoga therapy for 2 months, it come to mild stress. And in control group, the severe stress maintained at the same level. This is the beauty of yoga. It does magic when it combines with the modern medical management. And the most important finding of this study is in the control group, of out of 40 patients, 70 patients got relapse. Relapse is the one less number of relapse. Our treatment is very successful. When I joined MCS before 10 years, the success rate was 60 percentage. Now we recently calculated all the statistics were done. We have reached nearly 68 to 70% of success just by seeing the relapse rate alone. And in this study, we follow up the patients. We have a group of counselors and social workers who do a lot of work there, and we have a regular follow-ups also. Each week, we do a follow-ups. In this control group, out of 40 patients, 70 patients were relapsed and 11 were readmitted for de-addiction treatment. And in yoga therapy, only 9 got relapsed, in that 4 got readmitted. So 17, where is 17 and where is 9 standing? This is huge. The numbers may seem very comparable, but as a see the 17 family is suffering. That is the most important thing. Here only 9 family is suffering. I'm not telling that, but the effect is very much increased because of yoga therapy. The awareness increased. And how these things are happening? Because this prefrontal cortex plays a vital role in addiction and recovery. As know, the cognitive function is very high, the impulse control, craving, that self-regulation, decision making, and the most important thing is the emotional regulation. And that will play a huge role in the reward of short and long terms. In addiction, this whole prefrontal cortex is diminished, and the poor impulses in control that leads to an increased amount of craving, and that is the reason for relapse and coming again and getting yoga and its techniques strengthen the prefrontal cortex, and thereby it gives the better self-regulation, emotional balance, and we are seeing the result by reducing the relapsing rates. This is the importance of adding yoga as an adjunct therapy, the traditional techniques meeting the modern medicine. This is one of the beautiful study, and it is all these studies are available in ISCM website. If you want, you can download all the papers of ISCM. And next is the benefit of yoga in recovery. We found out it is a craving reduction. The most important is chronic pain. One one thing I will say, whenever I see a patient there, I will ask them, what is the reason for how you started taking alcohol? The most common thing is, sir, I have started this jovially with my friends and it has become a habit. And they suffer all kind of problems like pain, insomnia, anxiety, craving. Friendship is injurious in health in addiction. Underline the word. Friendship is injurious to health, especially in addiction. And definitely yoga helps to think better, and it will make a self, it will give us a self awareness, who to be in touch with as a friend, who to consider as a friend, just the normal person. It will just give you that much self awareness. And all these benefits will be gained just by practicing yoga techniques. And this is our recent study. Nilachal was a coordinator of this program, Yoga Sangamam, Yoga Samavesha, sorry. I don't think Nilachal would have seen these results. Um, this is nearly about 200 patients in the Mother Care Foundation. Special children's parents, the caregivers of the special children's, patients of the medical oncology, patients of psychiatry. We gave Under the Ministry of Ayush, we got the Samavesha program by Dr. Ananda sir's effort. And nearly 200 patients, where I mentioned all kinds of patients now, the Mother Care Foundation, uh, parents, special children caregivers, medical oncology patients, psychiatry patients, nearly 200 patients. They had 10 days of yoga therapy along with the model medical management, only 10 days, only 10 days. And we have studied by using this HATS questionnaire. And you can see the results is amount of stress has decreased more than all. And anxiety is also decreased. Depression is decreased. This is only 10 days of, I think, yoga as an adjuvant therapy to the modern medical management. The severity of getting an chemotherapy or radiotherapy, and during that time, by giving a pranayama to them, the stress, the depression of parents of special children or the caregivers every day, if they exposed to yoga, a kind of a relaxation technique, what will happen to them? It is shown in the result. This again in a psychiatric patient where you give all kind of drugs, that drugs will sedate you and make you sleep most of the time. Going into the ward of psychiatry and giving them a few shake and throw techniques and making them to do few nada pranayamas and see the beautiful changes which is happening in the monomaya kosha of those patients also. So significant reduction in all the parameters like stress, anxiety, and depression just by giving 10 days of yoga techniques. This schedule is designed by the Ministry of Ayush. We have given them and the result is shown here. So what happened in 10 days? What is the mechanism of action you think that? Yoga has a tendency to increase the neurotransmitters, the gamma, and the feel-good hormone serotonin. And I already told it directly work on the stress hormone and decreases it. And the most important thing is someone comes and speak to you. Someone is there to support you. Someone is there to watch you. The feel of that empathy and some shoulders is there to support you to improve your health. That is given by the yoga therapy therapist, the yoga instructors, and it increases the mood and well-being. When we go and speak, the patient always like to speak. See, when the patient is getting chemotherapy, simply lying in the bed, what will do? Unnecessary thoughts will come. That will increase all the negative things only. But when they do a pranayama, when they do some good type of positive feedback, chatting with the yoga instructors, automatically the mood will be enhanced. And that is what's shown in the results, in our results. So just by 10 days, we got this wonderful results actually. And the most important thing I want to say is how regular yoga practices helps by modern medical management. The improved health outcomes is seen in all the systems, all the vital organs in your body like cardiovascular, metabolic, pain, mental health. Most important thing here is the financial benefits. One pantoprazole tablet costs 16 rupees. If you do some kind of yoga techniques along to reduce the acid peptic disorders, you can save that 16 rupees. I'm just saying you example. One strip of oral hypoglycemic drugs costs around 100 rupees. And if you're going to put the tablet for morning and night, 5 days, the one strip will get over. And the next 5 days, you have to get one more strip. It is 500 mg. Adding yoga as an adjuvant therapy to your problem, that 500 mg can be reduced to 250 mg. So per day, you can take only one tablet and extra the strip, the same strip what you bought before, it will come for extra 5 days. So once in 10 days, you have to buy one strip, 5 days, 100 rupees, to 10 days, 100 rupees, a huge difference. Actually, the financial balance is also happening. And the 500 mg of side effect is reduced when compared to taking 250 mg of drugs. And once the financial expenses are low, automatically there is some kind of well-being is happening in each other. This financial stability is one of the important problem in recent world, especially after COVID. Not only by taking tablets, if your doctor sees that your sugar control, your blood pressure is normal, your weight is also normal, next day when you come for a revisit, he will ask only to do the glycosylated hemoglobin alone, the HbA1c test once in 3 months. He doesn't ask you to see the fasting blood fasting postprandial, urine retin, cholesterol, nothing is needed. If your sugars are in control, you come again after 3 months, do the HbA1c alone. So thereby you are reducing the money by decreasing the investigations or number of investigations also. All these plays a vital role. And again, there are not only reducing the side effects, automatically one problem which is there in the subconscious by doing yoga practice, it is automatically gone away from your body. That is a positive effect of yoga as an adjuvant therapy to the modern medical management. And it improves productivity and definitely the quality of life is increased. Spiritual, mental, social, emotional, all domains. And if all domains are in a manner, definitely our physical health will be healthy and it can be vice versa also. And last, I want to finish it by saying by combining modern medicine and yoga, these are the outcomes which I have seen with my patients every day when for a simple fever, what I used to say is take 3 days of Dolo 650, 6 hourly per day. Don't take spicy, so oily foods. Take liquid foods and take 3 liters of water is mandatory. Rest. This is my simple treatment. And after that, I will suggest some pranayamas if they are willing to hear me. And there is no aggressive activities for the next 2 weeks. And if you're already a cardiovascular patient, go and check your the echo scan, the heart scan, and stress test before doing an aggressive activity. And do some nada pranayamas that will keep you a vibrant mode, a positive mode, and your heart also healthy. So when the patient comes back and he says, I'm feeling good, that is the best gift, both as a doctor and as an yoga therapist. What much more I need than that? I am responsible for my patient health. If they are good, I will feel good. So just this is what I want to conclude by saying both the traditional wisdom is what our ancestors give. And when we combine it with the modern medicine, we shown it as a research evidence here. What a beautiful outcome in terms of physical health, mental health, social health, and spiritual health. You have seen the evidences now. That is the beautiful of these two drugs becoming an integrative medicine, and that is what the aim of Ananda Sir, School of Yoga Therapy of ISCM. All we want is everyone should be healthy. If you are healthy, the wealth automatically comes. So with that, I close and by saying alone we can do so little. Together we can do so much. So not by yoga therapy alone, not by modern medical management drug alone. Combined, we can do so much for the individual health, for others also. So thank you to all the people and heartfelt grants to my revered gurus for their wisdom and guidance, and to all the participants for their valuable presence and support. I want to thank Nilachal, who is the prime organizer of this Secrets of Yoga Therapy. I also, this is the second time. First time also he invited me. It means a lot, Nilachal. And whatever I do, whatever is coming to from my patients, all I submit to the divine feet of my Guru Dr. Ananda sir, my wife, my parents. It's unto Lord Hanuman. We want everyone to be healthy, happy. Namaste, Vanakam. Thank you. I'm ready to answer any questions are there. Thank you again.
Thank you so much, Balaji sir, to taking us to another dimension where we are experiencing both the modern medicine and the yoga chikitsa, and it was really an in very mixed, and that was the much needed approach, and that the way you have explained and the way you have taken both together. And the together, how you have mentioned, the teamwork is always important, and integrative approach is in a kind like that only, where we are combining all those different aspects of therapy together to with the only objective to make the person healthy holistically. So thank you for that, putting it together. And before going into the questions, I would like to invite Dr. Meena ma'am only to speak a few words.
Namaste, everybody. So that was a wonderful presentation. Always, very, very proud when I won't call Balaji my student at all because he's been there with us long time since Cider started, even before that in the tradition. And he's been doing plenty of work, good work, especially with the alcohol de-addiction and at School of Yoga Therapy also. So congratulations on that wonderful work and wonderful presentation. Thank you.
Thank you so much, ma'am. And also today we have with us Yoga Chikitsa Ratna, Joseph Lepeji, Anantaji. If you could share any views, it would be very helpful for us.
I just want to appreciate how clear and succinct the presentation was, how all of the most important aspects of combining the traditional approach with the yoga therapy was presented so succinctly, so precisely, so clearly, and with all the studies that that you've done in just such a beautiful way. So I want to thank Dr. Balaji for this wonderful presentation.
Thank you, Anantaji. And before going into the questions, all are invited to type in the chat or raise your hand. I'd like to invite Inganji to again speak a few words.
Thank you, Balaji. This was an amazing presentation. It was a very convincing presentation of how you can combine modern medicine with yoga therapy. And I think you demonstrated it with so many convincing cases. And also, I must say, I admire your work with the people who have drug problems, because very easily they become the outcast of society. And you were honestly telling about your own attitudes to begin with, but then perhaps your wife mostly convinced you that these people were worth working with because they're human beings like us. And I think one thing also that I noticed was that in order to work with people who have drug addictions, we also need to understand the pleasure that they experience in using drugs, because otherwise they wouldn't continue to do it. So we need to understand what motivates them, and also especially that after some time it gets beyond their control. So they need help from people who have a medical background, and especially a yoga therapy background. So I think you're doing amazing work, and you were so clear in your portrayal of that, very convincing. And I felt quite uplifted after hearing you, because yeah, you're doing so good work and you're conveying it so clearly. So thank you.
Thank you, Inganji. We have one question in the chat box. Uh, it is being asked by Diego. Uh, the question is, Pranam sir, can an overactive sympathetic nervous system cause high cholesterol even in people with good eating habits? Also, what are the best practices for bones health in ladies during their menopause?
Thank you, sir. Thank you for the question. So, first question is overactive sympathetic nervous system can cause high cholesterol in people with good eating habits. See, this cholesterol is a very, very difficult topic to address here, because we have seen the patient who have a cholesterol level of 400, 500 living very happily, and person who having a 200 or 250 cholesterol levels are dying up, because there is a withstand pressure is there within your heart area, and there are some kinds of inborn errors of metabolism of cholesterol also is there. So people who are having this good habits, even though they have high cholesterol level, they have to do some kind of investigation to find out why the cholesterol levels are still high. To addressing the root cause, that is the most important. First, we have to find the cause, then we can treat accordingly. That is the answer for your first question. The second question, best practices for bone in health. Sir, I'm not going to give the names of the practices here because I'm not going to give any prescriptions here because that is totally wrong. Because yes, menopause, there is a hot flushes, there is a hormonal imbalance, there is a less amount of calcium in the females, and each and every individual female is different. So I can't prescribe the techniques here. We want to understand the patient first, then we can apply those techniques to them in both medically and in the yoga therapy. So thank you for your questions.
Uh, Thank you for your answer, Balaji sir. Alokji, you wanted to ask one question. You raised your hand.
Uh, Thank you, Nilachal ji, and well done, Dr. Balaji. Your presentation was excellent, wonderful content, and very artistic presentation with Venn diagrams and spider web diagrams. It was excellent. So, very nice.
Thank you. Thank you, sir.
And now my question is something related to the response of your patients. When you prescribe both the allopathic medicine as a doctor number one, and then yoga therapy as a doctor number two. So how do they respond? Like, as a customer psychology, as a psychology between the service provider and the customer, I may have something in my mind that Dr. Balaji maybe is not so confident in his medicines. That is why he is prescribing the yoga practices also. So, please have give us some because since long you have been practicing both allopathy and yoga. So your experience regarding this.
Sir, I'm a student of yoga therapy, yoga first. I studied yoga from fourth standard of my schooling under Dr. Ananda sir. That is the first experience. Then I went into a medical person. So yoga first, then followed by allopathy. To answer your question, wherever I work, if I work in school of yoga therapy, first I will speak about yoga. In additionally, I will tell them I'm also a doctor. So these things can identify and we can give you further more treatments. If I work in my clinic, first I will give them drugs, give the investigations to find out what is the problem. Additionally, I will tell them, see, I'm also a yoga therapist. I have seen many patients has benefited by doing these things. So if you practice these things, the health will better. So according to the area, according to the patient, according to the situation, I put first of either one, either yoga therapy or medicine, then definitely I will give the next advice also to them.
Thank
You,
you,
sir.
Balaji sir. And if anybody have questions, you may type in the chat box. And just to take you back to the day first, when Dr. Ananda sir was mentioning when we talk about Yoga Chikitsa also, but the concept is always the same when we talk about yoga or Yoga Chikitsa. Yoga is for yoga, and this is a journey then where we are trying to evolve consciously and we are trying to get into the higher conscious state with all these practices. And this whole setup has been the made by our doctor sir, like when we are trying to build in this way. And before that also, the parampara, the Gitananda yoga tradition has a lot to offer in that. And these teachings actually help us to get through all these various aspects of yoga chikitsa. And the session that you have seen a few techniques that have been mentioned by Dr. Balaji sir, like the hatenas, the pranayam, and various other techniques, the Brahma Mudra and all. So these are the teachings that the tradition offers, and in every tradition there are many techniques that they offer which are very much unique to them. And in this tradition of Gitananda Yoga tradition, we found these hatenas and all. And it would not be to glorify in that way, but it is a very honor to have with us a doctor sir who is actually helping us to guide in various ways, and the parampara, where we are actually understanding in a very specific way and how to deal in both the integrative in the ancient concepts and the modern concept, and the integrative approach comes up. where we in the ICYR, where we are trying to have the Gitananda Yoga Chikitsa, and we are trying to deal with that. And in the ISCM, we have a similar modern approach integrating with the yoga therapy. So that's very interesting. So uh, I would like to just once, I think Dr. Sai is here with us. I don't know whether he is there. Um, so if you are there, would you like to share any views?
Thanks. Must say, sir. Doctor said Darshan is always special.
Namaste. Actually, I've been caught up with some other things, and as you can see, I wasn't really prepared to come on screen, but I was listening in the background. I have been doing that for all these sessions as much as possible because of some stuff I need to do for my travel and other things. I've been busy, but I really enjoyed today's session. Well done, Bala, and very beautiful comments have come in. And I would just like to stress on a very important point on this same regard, that often many people around the planet tend to pit modern medical approach with against traditional approaches of healing. There's a common tendency that it is us versus them. And this percolates down in so many countries, including India, where our medical associations are often pitted against traditional healing systems, knowingly or unknowingly. In fact, we have a very controversial aspect the government is trying to bring in, where they want to create a new course where people will be trained both in modern medicine and Ayurveda at the same time. And their idea is they will end up with integrative practitioners. I have my own issues with that because I believe integration is at patient care level, not at the primary education level. People should be educated and then integrate. But there's a lot of controversy, and Pondicherry is in the news for that because they announced it at JIPMA, and now JIPMA has denied it. So there's a lot of what I want to say here is there's a lot of us versus them. So modern medical doctors often think traditional systems don't have any value. Traditional systems often paint modern doctors as, basically egotistic, money-making villains. So, you have that type of, there's a painting of the opposite side. And this is why I believe Swamiji has given us a pathway of true integration, which I have tried to follow, and this is what Bala again follows, is that we can have the best of our traditional healing and the best of modern medicine working together for the sake of the ultimate end beneficiary, who is the patient themselves. And that as a doctor, your patient's well-being should be your primary concern, not which system you are using or whether your system is getting the attention it deserves or not. So there are places where modern medicine has an important role. There are places where yoga has an important role. And we have again and again seen how they can come together. So thank you, Bala, for this presentation. And thank you, Nilachal, for taking up this series, because I feel that through these type of series, we can educate our own community about what is there in Yoga Chikitsa and not reduce it to yogopathy, not reduce it to just a symptomatic management using yogic techniques, but understand the bigger picture. So thank you for taking it forward, and thank you to all our speakers. I missed the other day Dr. Meena's, Dr. Ingan's, but I've been watching the recording of all these sessions. And over the next few days, I'll again miss a few more of you because I'll be traveling. But thank you, Nilachal, for putting it together. And I would just like to remind everyone that this is part of a overall introduction to the upcoming Yoga Chikitsa one-year program that Nilachal and I are going to be offering, where many of these speakers will be part of our faculty and other eminent authorities will come in, like we did in the cultural appreciation. It is not just going to be me and Nilachal all the time. We are going to bring in Dr. Meena. We are going to bring in Ingan doesn't even know it yet. Anantha doesn't know it yet. But we are going to be inviting all these different experts to share because I don't believe that I know too much at all. What I have is a small cup. Well, maybe it is this cup that says Dr. Ananda on it. Okay, maybe that is what I know, but there's a big universe out there. And so this is part of taking in for that. So thank you so much, Nilachal. Thank you everyone for being part of it and maybe be worthy of yoga always.
Uh, thank you, sir. Thank you for your presence. And we know like we are always there, but better to see you live also. So thank you so much, sir. Um, and we have one question with Antonio. Uh, you can have a 1 minute of, you can ask a question, and Balaji, sir, you can have a short answer to Antonio's question. Yes, please.
Namaste. No, I would like just to say thank you to Dr. Balaji. That was an outstanding presentation. And just 30 seconds to share my experience as I am dealing with some heart problem. This is atrial paroxystic fibrillation. And when I started with my pranayama sadhana, that is a daily sadhana, I didn't have any attack anymore. And there are now more than 12 years that I don't have any kind of this problem. And I shared with my cardiologist that I do yoga and my sadhana is pranayama and other asanas. And he told me, Antonio, you have reached a perfect balance between the drugs, as I have to take 3 times a day pill, this is propafenone, but my body and my sadhana and the drugs work together in a sort of harmonic balance. So this is just my, let's say, my experience and that I would like to share. And my cardiologist told me, okay, I have to start to do yoga as well.
Thank you, Antonio. Thank you for sharing this. And yeah, so we come to an end and we'll finish with the Loka Samasta. And uh, just to let you know that tomorrow we have another session. Hope you can see with Miss Priya Philip. And the topic is yogi counseling and conscious living, role of yogi lifestyle in inner healing. So you're most welcome for tomorrow's session. Let's finish today's session with the Loka Samasta. Om Loka Samasta Sukhino Bhavantu Sarve Janaha Sukhino Bhavantu Om Shanti 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 Om. Thank you all. Thank you, Balaji sir. Thank you,
Thank you,
Doctor
Nilachal.
sir. Thank you, Meena ma'am. Thank you, everybody. Thank you for being a part in this journey. Namaste, pranam. See you tomorrow.